Our next presenter is Koo Whang Chung, a distinguished health scientist with a wealth of experience in epidemiology. With a Master of Public Health degree from Emory University, Mr. Chung brings a depth of knowledge to his role. For over a decade, Mr. Chung has been a vital member of the CDC, notably within the Division of Healthcare Quality and Promotion since 2011. Currently serving as Deputy Team Lead and Environmental Infection Prevention and Control Coordinator for the consultation team, he's a driving force behind healthcare quality and safety initiatives in Atlanta, Georgia. Mr. Chung's impact extends beyond his day-to-day responsibilities, evident in his authorship of over 550 research publications. His extensive contributions to public health knowledge and practice underscores his dedication to advancing epidemiology and infection prevention. At this time, I'll stop sharing my screen and ask you to please join me in welcoming Mr. Chung for a very interactive presentation on environmental cleaning and disinfection.
Hello, thank you so much. I'm going to go ahead and share my screen now. Thank you all for letting me join you today. Again, my name is Koo Chung, and I'm with the CDC Division of Healthcare Quality Promotion in the Healthcare System Strengthening Resiliency and Training branch. Actually, I'm going to go ahead and turn my video off so that we can focus on the slides. Let me know if you can still see the slides. Great. All right. So today I'm just going to be going over a quick background on the 5 elements of how germs spread and cause infection. We're going to go into a little bit of detail about the differences between cleaning, disinfecting, high-level disinfection, and sterilization. I'm going to briefly touch about on risk recognition and risk mitigation, but I think you guys had a really nice presentation this morning about that. And then I'll dive a little bit into our core components of environmental cleaning and disinfection in healthcare settings. And then we'll wrap up the presentation with a few slides on emerging technologies. So we all know that healthcare-associated infections, or HAIs, affect a wide swath of healthcare, with CDC estimating that 1.7 million infections and about 99 associated deaths happened back in 2021. And there are several ways that patients can be exposed to HAIs, and that's from other patients, from themselves, contamination from devices and medication, and why I'm here today from the environment as well, which includes water, air, and environmental services. I really like to show this picture here because this is a nice representation of, not everything you see is what you see. Here's an example of vomit, a simulation of vomit, and just because you can only see those little bits of brown doesn't mean it hasn't spread to more than what you can see. It's a very good example of why cleaning, disinfection, and thorough cleaning disinfection is important. We can talk ad nauseum about all the different outbreaks that have happened that are related to environmental contaminants. I think the most important thing that I want to take away from this slide for you guys is that the settings. This can happen in almost any setting within a healthcare organization, anything from long-term care to ICUs, dental clinics, even protected spaces like NICUs. This can be a problem, this being poor cleaning and disinfection. When we're talking about reservoirs, or we're kind of talking about where you might be able to find these germs. And this is kind of a Project First Line twist to how to describe this. But generally speaking, we like to describe the reservoirs of germs as water and wet spaces. So think sinks, faucets, drains, ice machines, therapy pools, things of that nature. Dry surfaces are what you're thinking about when we say disinfecting of surfaces. Door handles, bed rails, curtains, light switches, so on and so forth. Then we're talking about dirt and dust. So this is mostly related to when you have large construction projects or minor renovations that are happening within your facility, and understanding how to mitigate those dangers. That's what we talk about when we say dirt and dust. And then obviously devices, hip replacements, endoscopes, blood pressure cuffs, stethoscopes, glucose monitors, so on and so forth. So the persistence of pathogens is also important too, because as you can see here, they range from a couple of hours to many, many months. and they span the gamut of bacteria and fungi, as well as viruses. So here we're going to talk a little bit about the differences between cleaning, sanitizing, disinfecting, high-level disinfection, and sterilization. I think I'd like to spend a little time on this slide because in many scenarios, um, these terms can sometimes be used interchangeably, but in the world of cleaning and disinfection and environmental services, these all have very specific meanings. So first, which is cleaning, is the removal of dirt that you can see before disinfection can happen. So this is the use of something like an enzymatic detergent, so like a soap, to help dissolve and remove, so lift and remove away dirt and debris before you can actually disinfect. So next is sanitizing. So this kills and reduces bacterial contaminants on a surface using a chemical. And sanitizing is not really intended for viruses, although EPA is currently reevaluating sanitizing claims to include virucidals. So that's still to be determined. But generally speaking, when we're talking about sanitizing a surface, we're talking about food service applications. So these are disinfectants or sanitizers that are food safe, food contact safe. And I think the most important thing that we're talking about related to cleaning and disinfection, I think, is disinfecting. And this kills most germs on surfaces and objects. And this is happening after the cleaning step. And this is done using a chemical called a disinfectant. And then these last two, I'm just going to briefly touch on them because they're not really intended for the environment. So high-level disinfection is the complete elimination of microorganisms. And this is in relation to medical devices. So think of scopes, for example. And then we have sterilization, which is the complete and total destruction of all forms of microbial life. And think of these as devices that are being sterilized or autoclaved, for example. So artificial hips, surgical equipment, things of that nature. So we're going to play a little game here. I have my chat window open, so I think you guys are able to drop things in the chat. But here are 12 ideal properties of a chemical disinfectant. And I've put some icons here to kind of describe what and give you a hint as to what it might be. Why don't you, take a look at these, and in the chat, or I think you might even be able to come off mute, just shout out me what you think some of these icons might mean as 12 ideal characteristics of a chemical disinfectant. Contact, wet time, perfect. That is one for sure. Fast acting, dwell time, yep. Cost, that's right. It has to be economical. What else do we got? Nose inhalation, yeah. So here it has to be odorless. That's right. Non-toxic to humans. That's right. Non-toxic is another one. Poisonous. That's right. Cleaner. It should be a cleaner as well. That's a great one. Animal safe. I'm gonna go ahead and call that non-toxic. Odorless. We went over that. There we go. Right there. Odorless. Any other ones? What about disinfectant time? Yep. Fast acting. That's a great one. Environmental contaminant. I don't know what you mean by that one. Tag outdated. So the tag, that's a little tricky one, but it's so that the instructions should be clear and easy to understand. Eco-friendly, that's right, environmentally friendly. Some other ones that are a little bit difficult, but broad spectrum is another good one. This one is about surface compatibility. Yep. And this one, leave a residual. We can hit on that a little bit later. Yep, someone mentioned it here. Not affected by the environmental factors. That's a great one. And then the last one is stability. That's right. Someone just got it. Thank you, Nicole. And then the last one that's required on all chemical disinfectants in the United States. Can anybody guess? Yes, EPA registered. That's right. It has to be a US EPA registered disinfectant. Great. Great job, guys. Great job. So to tie in a little bit of the few slides from before, we're going to talk a little bit about this slide here, resistance of pathogens to disinfectants. So we have low, intermediate, and high-level disinfectants. Again, high-level disinfectants, we're talking mostly about device reprocessing, so let's not really think about that right now. Most of the cleaning and disinfection that's happening within a healthcare environment is low-level disinfection or intermediate-level disinfection. And as you move up the hierarchy, it becomes more difficult to quote-unquote kill. So the most difficult thing to kill, obviously being prions, not so much of an issue right now, but the one that we're most concerned about are spores, right? So these are the C. diffs of the world that we're talking about here. So those are the most difficult to kill, which require a chemical disinfectant that's considered an intermediate level disinfectant. So think about bleach and hydrogen peroxide. Some quartz and alcohol blends don't actually work against spores, but they are pretty good at everything else. You see that little gap in that light green for quartz and alcohols? That has to do with norovirus. There are some quartz, and we don't actually know the answer to this question, but there are some quartz that just straight don't work against norovirus, and we don't know why. But these links here on the right bottom corner give you a great breakdown of the different disinfectants that are out there. That is the active ingredients that are out there and why and how they work. I recommend taking a look at these. They're really great resources. So factors affecting the efficacy of disinfection. So we talked a little bit about these when we were talking about the ideal properties, but it's important that before disinfection can actually occur, cleaning must be done too. You have to actually be able to move or get rid of that bio buildup, that gunk that we're talking about, before the disinfectant can actually do its job. So type and level of germs, so the bioburden and the type of bacteria or bug that you're trying to disinfect, that also makes a difference. The concentration and contact time are also important when we're talking about the efficacy of disinfectants. The physical nature of the object. So is it difficult to clean? Does it have a lot of crevices? Is it cracked and broken? Is it hard or non-porous, or is it a soft porous surface? Things of that nature. And then obviously the big elephant in the room, biofilms. But we also talked about a little bit temperature and pH and humidity as well as affecting the efficacy of disinfectant. So think of, if you're in Arizona in July and it's 110 degrees, you could imagine that your alcohol blended disinfectants may dry a little bit faster. So I'm just going to briefly talk about this slide. I know you had a full hour presentation on this. I think the important thing to recognize here is that there is a role to play for IPs in the world of cleaning and disinfection to help folks understand the risks related to the environment, to patient safety. So seeing the potential for a problem to happen, not that a problem will always mean to a negative outcome, but I think it's an important thing to mention here as well. So here we're going to play another game. Here's a picture of a patient room. Using the chat again, can you identify in this picture any risks that you might see from the environment? Go ahead and start dropping it in the chat. The floor. Yeah, there's a little bit of dirt and grime on the floor. People always point that out, but that's actually not one that I wanted to point out here. But yes, that is a good one. The dirty blanket. That's another one that people point out that I did not actually highlight here, but I'm glad people are pointing that out. What else you guys got? The trash can. That's another good one. That one's not full, but I see where you're going with that. Food. That's right. The bedside table is always a big one, right? Understanding how to clean and disinfect the bedside table, and more importantly, in some instances, understanding, there are a lot of times on the bedside table, patient personal items that need to be appropriately moved and handled, and so on and so forth. So these are types of communication that should happen between your EVS staff and nursing, as well as the patient as well. Let's see what else you guys got. That's right. The phone, the call button. What else you guys got? The chair, that's right. The chair is a good example of a high touch area that is a risk to patient and visitors. The handrail, that's right. The handrail is always an important thing to clean and disinfect. IV pole is another good one. We're going to get into a little bit about this more later. I think those are all the ones that I highlighted here, up to 6 of them. So great. I think you guys got a lot of them. The blood pressure cuff is another good one as well, but that's not the one that I highlighted here. So here's another one. This is looks like an outpatient room, right? or a clinical setting. So what do you think are risks in this picture here? Sharps container. That's right. Oops, sorry. I thought you guys might catch that one pretty quickly. Sharps container, full trash can. That's right. Splash zone not clear. Yes, you have, not only do you have cotton swabs, but you also have medication next to the splash zone. It's a little bit hard to see here, but I also pointed out here, it looks to be a microfiber cloth right here behind the cold water tap. That's also like, what the heck, guys? Why would that be there, right? And then what else you guys got? Items behind the sink. That's right. All of these things in the splash zone are dangerous. What else do you guys got? Okay. The other one that I thought would be important to mention here is this random biohazard sticker. What is it pointing to? Why is it there? Is it really biohazardous? And if it is, should it be there? That's great. How many do I got here? Six. Six. Perfect. We got all of them. Great. 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 All right, so now we're going to move on a little bit to the core components of environmental cleaning and disinfection in healthcare settings. Um, so I don't know if you guys had an opportunity to see this, but I've left this link here for you guys to take a look at. It's unfortunate because this actually went live on the CDC page. I think it was October of 2020. I think we all might have been a little bit busy during that time, so this might have gotten buried. But I highly encourage you to take a look at this. We're going to step through a few of these core components, but generally speaking, these are six of the major things that we think a cleaning and disinfection program should include. So starting off here with integrating EVS. So establishing a healthcare facility cleaning and disinfection program, this is incredibly important. And I think the one thing that I really want to harp on here, if there's one thing that you guys take away from this entire conversation that we have, is that people within your EVS program, your EVS department, should be part of your multidisciplinary team. That's part of your hospital safety culture. They should be included with your IPs and your, purchasing, your facilities management, your leadership people, your DONs. These people should be in this room when these conversations are happening and not thought of after the fact. They bring a wealth of knowledge to the table that could help with the decision-making processes, as well as helping understand a clear and reporting and accountable structure within your facilities. So education and training, this is another important thing that that I think is often sometimes overlooked, but I want to point out this first bullet point here, that healthcare personnel, other than EVS, so we're talking about nursing, respiratory therapy, maybe even your nutrition department, will may also have cleaning and disinfection duties. How many of you understand or know of the demonstratable competencies that these non-EVS personnel have to go through to understand that they know what it means to appropriately clean and disinfect using the disinfectants within your facility. That's something that's kind of important that we really want folks to be able to understand. Tailoring this education, the education level and languages and learning styles, so making sure that your training meets the needs of your personnel is also incredibly important. But at minimum, we think that training should be happening when folks are hired into your departments, at least annually. When you introduce new equipment or protocols, that's kind of an important one. There's also just-in-time training for when there's outbreaks or when there's a threat that's detected, or when you've identified challenges through routine auditing activities. And we'll get into a little bit more about auditing activities later down the line. But also something else to keep in mind is when you are training and educating, making sure that you're keeping documentation of all of these. Documentation is incredibly important when we're talking about surveys, right? So here's another little quick game. So we're talking about selecting products here. Wait, did I miss one? No, I think we're good here. So we're specifically talking about here the do's and don'ts of an EVS cart. Go ahead and use the chat box again. So think of some of the do's. What are some of the important things that you should do on a cart? Food and drink. Nicole, we'll get to that in a second. Keep it clean, keep it locked. That's right. Keeping it locked is incredibly important. Making sure that the disinfectant compartment of an EVS cart is locked, separating clean from dirty. That's right. What else? Daily cleaning, disinfection. Don't leave water in it. Clean the cart regularly. That's right. Oops. Here we go. Restocking the cart. Okay. And then separating clean from dirty. That's right. Changing mop heads. Right. Okay. So dry on top, wet on bottom. Exactly. That's a good one. Top to bottom, wet to dry. And then here are some of the don'ts. You guys are going ahead a little bit ahead of me. Definitely no food and drinks, no personal items. So this includes cell phones, water bottles, keys, lotions, lip balm, lip gloss. These are things that don't belong on an EVS cart. That's right. No air fresheners, please. No air fresheners on the EVS cart. This last one is a little bit tough, but no Johnny mops on an EVS cart. I mean, unless they're clean. But toilet brushes do not belong on an EVS cart. I mean, that's kind of a no-brainer, right? And then making sure that you don't leave the cart unattended. That's kind of an important one as well. I think you guys got a lot of that. That's awesome. Great. Yeah, that's a good one actually. Should only have facility and hospital approved cleaners. That's a really a good point to make here. We don't want folks bringing in their homegrown fabuloso or whatever it may be for cleaning floors. So whatever, and only the things that are within your hospital protocol should be on that cart. That's a great example of one too. Good job. Okay, so selecting chemical disinfectants and cleaners. We're going to dive a little bit deeper into this. Let me check time. I'm doing good on time. I'm talking really fast, guys. So if I'm talking fast, just say something in the chat box. So selecting cleaners and disinfectants. So the EPA has a really nice list of all of the registered EPA disinfectants and the use cases for them. So we have ones that are specific for C. diff, for bloodborne pathogens. Actually, that one right there, the bottom one, list S, EPA registered antimicrobial products effective against bloodborne pathogens. This is a brand new list. This probably is maybe 2 or 3 months old, maybe less. Before all of these bloodborne pathogens were on their separate lists. There was like list D, E, F, G. And they were like overlapping. So there was an HIV one, there was a Hep B one, an HIV and Hep C one. So they just consolidate all of their bloodborne pathogen disinfectants into one list. But if you're looking for a disinfectant and you want to know and you're looking for a specific one, this is a good place to come look. And again, this is one of our nice little products that we like to share. This is co-branded with EPA as well. But not only is it important to be selecting the appropriate disinfectant that you're trying to use for your facilities, but making sure that you are following the disinfectant label to the T. Let's remember that EPA registered disinfectant labels are the law. It is important to follow it exactly as written, or you're using that product off label. There are many aspects of the disinfectant label that are important, but here are some that we've highlighted here. So understanding what the active ingredient is, understanding where and how to find the EPA registered number. The directions for use is incredibly important because it tells you how to use it, what it kills, where you can use that product, the contact time. I cannot stress how important understanding contact time is and making sure that everybody within your facility understands that each disinfectant may have their own different contact time and understanding what that means. So if you're using a product that has a 10-minute contact time, it's quite possible that that disinfectant may dry before that 10-minute contact time is up, which means you have to reapply that disinfectant. And then you have all of these precautionary statements and first aid, how to store and dispose of it, as well as caution words to make sure people are understanding the level of PPE and so on and so forth that need to be used for that specific disinfectant. So I wanted to also make sure that folks understand that just because the outside of a disinfectant may look different, the inside, the actual contents of that disinfectant may actually be the same. So if you look at an EPA registered disinfectant, the first 2 sets of numbers may be the same, but that last 3rd set or 4th set of numbers may be a little bit different. And that just might be a disinfectant that's being sold or manufactured or labeled by a different organization or company. So if you go to that EPA registered disinfectant page, that first link you see on the bottom right-hand corner, they do an excellent job of explaining to you how to read and understand a disinfectant registration number. I highly recommend taking a look at that as well. And then lastly, many people have mentioned this, but yes, the SDS sheets are incredibly important. These should be available in for either electronically or on paper, usually either on the EVS cart or in the EVS closet on the floor or ward. It's important for that to be available as well. It contains a wealth of information about the safety of using this chemical and disinfectant and the precautions for that disinfectant as well. So I'm going to dive a little bit deeper into disinfectant master labels. So the EPA's PPLS, the Pesticide Product and Labeling System, there's a link at the bottom right there, is a good place to go to find the EPA master label. I'm using this one as an example. I just typed in bleach and I blanked out the specific product name, but rhymes with Lorax. But so if you type in the product you're looking for into the PPLS system, it'll show you an entire list of all of the active master labels for the products that are listed there and the dates that these were accepted. It's important to make sure that you're picking the most up-to-date or most current date. So for this specific example here, you can see it's kind of hard to see, but in February 10th of 2021, EPA accepted a new master label for this bleach product. The reason these bleach products or these master labels are important is that the master label contains, so the master label for this bleach product is actually, if I'm not mistaken, it was 37 pages long. It's a PDF. Now, do you think 37 pages fits on the back of a bleach label? Probably not. It won't. So these master labels contain way more information than what's available on the label that's on the back of the bottle. So it's nice to take a look at these labels because what is on the label is what EPA has authorized the manufacturer to make claims for. They can market to these things. So if you take a look at these labels, they get really, really in depth. So for example, for this specific product, we talked about it a little bit before, but they give you specific instructions for sanitizing surfaces as well as for disinfecting surfaces. And it goes even into more detail about the specific organisms that these are effective against, and it even gives you the ATCC strain number, so you can even go and look up the strain that you're looking for as well. It gives you specific instructions for these are relevant to the healthcare setting, but it gives you specific instructions on the effectiveness of this specific product as a tuberculocidal or a virucidal, and it gives you instructions about how you can dilute this product and instructions for use and where you can use these. So these labels contain a wealth of information, and these are just examples of how in-depth these labels can actually get. It even gives you examples of how to use this to disinfect potable drinking water, and my favorite here, how to sanitize eggs for all those folks that have homegrown hens for hatching, for eggs. So developing systematic cleaning and disinfection protocols. So this is an important thing to discuss as well, is to make sure that you have a standardized protocol for all of your cleaning and disinfection steps within your facility. So it's important to develop these standardized cleaning procedures, paying particular attention to making sure that you're addressing all the major patient care rooms and types that you're discussing or mentioning, routine and discharge or transfer procedures, as well as the use of appropriate PPE, and if you have any special pathogens, a specific pathogen level disinfection that you're doing for example, any patients that may be under transmission-based precautions and so on and so forth. And we touched about this briefly when we were doing some of these exercises, but developing processes that also address the storage of patient and visitor personal items is also very important, particularly to those patients in long-term care facilities or some of our patients that may be long-term in our acute care hospitals who may have a lot of personal equipment within the room, making sure that you understand how to move and replace these items carefully is an important consideration to make as well. So making a plan. So who cleans what? So this is important to discuss, um, to define the roles and responsibilities of who's cleaning what and when they're cleaning it as well. I like to use this example that I heard, I think this was last year APIC. I gave a very similar presentation, but I heard from the crowd, from an IP there, that during daily cleaning, the EVS staff were responsible for cleaning the IV pole, but that the nurses were actually responsible for cleaning the infusion pumps themselves. Now, that that level of detail is incredibly important to understand because it's easy for somebody to miss the cleaning and disinfection of that pump, for example, or the pole, if that level of clarity isn't discussed beforehand. So I encourage folks to make a list of all the high touch surfaces within your facility, making sure that you're including all the appropriate people, your EVS, your DONs, your management, so on and so forth, so that you can make that list, assign the right people, and understand the frequency in which these are going to be done. Because the last thing we want to get to is this pointing game of, no, it was you, it was you, it was you, when in fact, all of this could have been potentially mitigated with a clear SOP. Assess the room. All right, I'm going to rapidly go through this. This is just to highlight that it's important for facilities to understand that before an EVS technician steps foot into a room, they need to be able to understand, just like all other healthcare personnel that are walking into that room, the precautions that room is under. So in this specific scenario, this room is under contact precautions. So appropriate PPE should be used before entering that room, including EVS staff. And importantly, understanding that everybody who's going to enter this room needs to have the appropriate training and education to don and doff PPE in these kind of scenarios is important as well. So making a plan. These are some really high level, EVS technician 101 kind of things that we like to talk about. So when an EVS technician walks into a room, they're making a plan as to what they're going to do before they walk into that room. And some of the things that are drilled into the heads of EVS technicians is to make sure that you're moving in the same direction in the room, whether that's clockwise or counterclockwise. This is to prevent you from missing a specific area as you're working your way through a room. It's also important to clean from clean to dirty, so that you're making sure that you're not cross-contaminating. And always cleaning bathrooms last. Also, moving from high to low is important as well. This is less important when we're talking about a daily cleaning. We don't expect EVS technicians to be, wet dusting high surface areas with patients in the room. But for a discharge of a room, it might be important to make sure that you're dusting high to low, and then cleaning from left to right, and then from clean to dirty, and always cleaning the bathroom last. I think the one caveat that I'll mention here is that a lot of EVS programs, one of the first things that they do, that a technician is trained to do, is pull trash first. And I think that's okay, as long as you're appropriately doing hand hygiene between moving from a dirty activity to a clean activity. Yeah, Jennifer, I see your comment. Let's get to that toward the end. So monitoring and auditing, this is also obviously important. It helps identify issues and strategies to mitigate them. I want to make stress that this isn't intended to be a punitive action. This is solely for the purposes of training and improving practices. Particularly, let's say if you are bringing in a new piece of equipment or new SOP, making sure that you're doing the monitoring auditing to ensure that these practices and these new SOPs and these new technologies or equipments are being used appropriately. That's important as well. And then to provide that feedback to improve practices, it's important. So some ways that facilities have used to evaluate and monitor their practice are visual, fluorescence, ATP, and micro. I'm not going to really talk about micro. It's kind of like the the most expensive and most difficult way of doing it, but many facilities are using some combination of either visual, whether that be a direct visualization through secret visualization or management walking through and following their technicians through a cleaning. Fluorescent markers is a very popular method as well as ATP. Many of these have their pros and cons. They're outlined here. I'm just very lightly going to touch on emerging technologies here. And I think the most important thing that I want to say before we dive into any of these is that these technologies should be considered a supplement to actual manual cleaning and disinfection. None of these should take the place of cleaning and disinfection. So cleaning and disinfection is still gold standard. You still need to go in there, elbow grease, disinfectant, microfiber cloth, clean this stuff up. So I'm just going to very briefly talk about two of the ones that I just mentioned here that we saw here, surfaces, vapor hydrogen peroxide, UVC, electrostatic sprayers, and then dry hydrogen peroxide. I'm just going to talk about these UVC, this first one here. So this ZenX Light Strike is the first one that has been granted de novo status by FDA. So this is a new device classification. And it's considered a whole room microbial reduction device. And this classification is a medical device to be used to reduce microbial load on medical device surfaces following cleaning and disinfection. Again, making a point here to say that it's following cleaning and disinfection. So this, as far as I know, and I just checked this morning, this is the only one that has been granted de novo status. So I could see in the coming months and years, many 510Ks coming out through FDA for predicate devices in this world. Electrostatic sprayers, this is another one that I like to bring up. This is just one example, this image you see here. And the way this works is by charging the antimicrobial liquid, in this case a disinfectant, as it passes through the nozzle. So you positively charge the droplets, and these positively charged droplets are attracted to negatively charged environments. Our environment is just generally speaking negatively charged. So that's how that works. And some factors to be considered here when we're talking about electrostatic sprayers is the contact time, the minimum and maximum spraying distance when you're talking about these devices, making sure that you're actually physically turning on the device to ensure that you're charging the particles that are passing through the nozzle, and then all the slew of PPE considerations that have to be considered when we're talking about electrostatic sprayers. So the technology of electrostatic sprayers have actually been around for a really long time. Have you ever seen a crop duster dusting crops? That's the same technology that's being used. These images here are specifically here because I wanted to make sure that folks understand that there's a nice article, bottom right-hand corner, the second PLOS journal here. This article that kind of describes in a little bit more detail the pros, cons of, and how EPA evaluates electrostatic sprayers. And I just wanted to point out this top image here. You know, a lot of talk around a wraparound effect when we're talking about electrostatic sprayers. So if you look at this image here, the first top left quadrant, that's the front. So if you're thinking about pointing the nozzle directly at it, those little speckles, that's the actual disinfectant being distributed across that surface. And then top right and bottom right, These are the left and right quadrants of a spherical shape. And then the bottom left-hand quadrant is the back of the device. So you can see wraparound effect, not so great in this simulation here. Several publications that we can talk about, but the most important thing, this bottom one here, systematic review. We should continue to support traditional infection control practices, including cleaning, without undue reliance on novel technologies at the present time. That's what this specific systematic review said. And again, our perspective is these emerging technologies are just adjunct to the actual cleaning and disinfection that should be happening by EVS. So it does not replace cleaning and disinfection. There's a lot of data that still needs to be generated around this. There has been evidence to show that there are microbial reductions using these emerging technologies, but they all have their limitations. Careful consideration should be made when you're talking about the cost benefits and the risk benefits of using these before you use them. And here's my summary. So healthcare environments are clearly an optimal habitat for infectious organisms. Cleaning and disinfection are a critical strategy in preventing disease transmission. Hopefully, through this talk today, that's abundantly clear here. And monitoring and feedback may optimize staff performance. Maintaining training and competency checks is important. And let's not forget that this is a team effort. I think it's incredibly important that we take away from this conversation here today that cleaning and disinfection, your EVS technicians, they shouldn't be an afterthought. They should be involved in the conversations upfront. They have a wealth of knowledge that they can provide you and experiences that you may not know of that they deal with on a day in, day out basis that could be helpful in you making your decisions and creating your SOPs within your facility. And that is the end of my presentation. I'll put my video back on. And I'm going to really quickly scroll through these questions and see if there was anything that I might be able to answer. Okay, so where do you recommend storing toilet brushes in long-term care facilities, particularly a memory care unit? That's an excellent question. So not only that, but this also comes up in psychiatric wards. Where may you put these type of devices, these type of mops, the Johnny mops or toilet brushes? And that's a really good question. It's a really difficult question to answer. I think every facility does a little bit differently. There are options out there, for example, disposable. If your facility can afford it, disposable ones are not a bad idea. I just think the most important thing to think about is making sure that you're not moving a wet, dirty, used toilet brush from room to room. That's a big no-no. And then putting that on the cart and then moving, it's just, it has a big ick factor. So just consider these things before you make these decisions. And I guess that's the best I got for you right now. Sorry. Is there any reason why EVS staff cannot clean up spills in the floor, such as vomit or stool? No, actually. I think that is an appropriate thing for EVS to do as well. And in fact, they're trained to do this. I think the question that you might be getting to here, nurse has to clean it up first. So that, I think, is a facility-to-facility based thing. I was just at a facility the other day where we were having a nice discussion where EVS are responsible for cleaning if it's a non-patient care area, think ED waiting room, hallways, things of that nature. Clearly, EVS is going to be the first one there. In those specific scenarios, when we're talking about large vomit on a floor of a busy corridor, you also have to be thinking about health and not just the infectious nature of that material on the ground, but slips. You have to be thinking about that, which is a big part of what EVS is thinking about in that specific scenario. So I think it could be a both thing. Nurses could be involved as well, and so can EVS staff. And I think those just need to be really well defined within your hospital SOPs beforehand, so that we're not doing Spider-Man meme pointing at each other, who's on what. Okay, what is the recommendation for inspection and cleaning of privacy curtains in patient rooms? That's a really good question. I think I hate to use this again, but I think this is all dependent on how your facility views that as a risk and what is your risk tolerance for that as well. There are a lot of really great technologies out there that facilities can tap into when it comes to privacy curtains. I know this is a huge issue as to when and how and who and all those things. But I think the most important thing is making sure that you have a plan for how you're going to deal with that when X, Y, and Z scenarios happen in your facility. Let's see. Whew, I went through that really fast. Any other questions? Anything else that I can help answer? I think I have 2 minutes left.
There was a question, if these slides will be available on PFL to share with the EVS manager.
So these slides on the CDC PFL page, no. I think these slides, and correct me if I'm wrong, Chelsea and company, if these slides are going to be PDF'd and put into a booklet, I think that's what I was under the impression of.
That's correct. Oh,
Great,
sorry, go ahead,
great.
Chelsea.
But noted. So you guys do think that this is a useful presentation that we may be able to consider putting on the CDC page for EVS folks? Like, tell me yes or no.
Yes, I would say that it would be very helpful for our EVS colleagues. Yeah, we're
Okay.
getting quite a few yeses there.
Noted. Noted.
And then did you see the question related to inspection and cleaning of privacy curtains in patient rooms?
I did. I tried to answer that, but I'm sure I gave a very
Okay,
government
sorry, I
answer.
didn't hear that. I'm sorry. I apologize. Okay.
I gave a very CDC government answer on that one, and I'm sorry. It's a question that we get a lot, and I think facilities have it's so facility specific and use case specific that I don't want to get into too many details. But I think again, very important, making sure that you have an SOP, a plan in place, that you've discussed these with all the necessary people before the event or thing happens, so that you're not trying to, on the spot come up with an idea what you're going to do with that thing.
Yeah. All right. Well, thank you very, very much.